Hi, everyone. Welcome to a counseling skills lecture. I'm Dr. Allen, and today we are going to jump into the skill of asking questions. So until now, you've been asked to use either invitational skills or paraphrasing and reflecting skills to keep your sessions going with your client. And we've explicitly asked you not to use questions. Now, I know that feels like it made things a lot harder, but you might have recognized now just that innate pull to ask a question first thing or consistently and how that impacts the session. And so after this video, you will now have the world of questions open to you. But as you figured out already, those and from your own reflections and inclinations on questions, this is not as simple as it seems. So to help, I'm going to go over some cautions with questions and why it shouldn't be your first go-to skill in a session. Then we'll talk about how to use questions effectively. It really is an art. And then finally, we will look at some considerations to have. All right, let's jump in. So some things to consider. As you know, questions are often overused and lack intentionality. We ask too many or the wrong kind, and they can be easily abused, distracting, or can sidetrack the flow. It could really pull a client off track. And it may appear as an interrogation or an evaluation. And that's not what we want our client to feel when they're in session. So some cautions to have, what we want to avoid. We want to avoid bombarding or grilling our clients. That's when we ask too many questions and the counselor has too much control. So you might ask a question and then they respond. And then instead of reflecting or anything else, you ask another question and then another question and another question. And it feels like an interrogation at that point. So my recommendation is you ask a question, you listen to their answer, and then you use a different skill right after that. If you don't know what to do a paraphrase. Paraphrase their response to you because one, that helps them understand and see that you understand what they said. And then it also gives them a chance to clarify if you misunderstood the question or if they misspoke. I tend to like to see it as honoring the fact that they answered your question. I'm not just going to ignore their answer and then jump to another question immediately. I'll spend time looking at that answer they provided. Another thing you want to avoid is asking multiple questions. That means in one statement, you've asked 2, 3, maybe even more questions. So an example of that might be, how did the interview go? What are your next steps and what are you going to do to take them? Well, that's a lot. Each one of those 3 questions could be really a good chunk of time within themselves. So hold your enthusiasm back. You might want to jump ahead, but just ask one question at a time. Now, this last one's a big one and definitely something we want to avoid as counselors. It's using questions as statements or as leading questions. So sometimes our questions can serve as a way of us subtly giving advice to the client. We might think that we're not doing that, but in reality, that is what they're picking up. So, and it also tends to push our agenda if we're either giving that advice, and I'll explain that in a second, or leading them. And it'll stop communication because if they disagree with you, how do you respond to that? Just like, yeah or no. It could put up that defensive wall between you and the client and cause a therapeutic rupture. This is definitely something you want to avoid. So what I mean by subtly giving advice, if you tend to, I see it as if you use like a do, did, or don't questions, that's you giving advice. So don't you think it would be helpful if you studied more? Oof. So we're saying you should study more. That's what that statement says. It's not a question, right? How do you respond to that? So instead, you want to ask something else that just opens up the floor for them to give an open response either way. So an example might be, what occurs to you as you think about improving your grades? See how that's a little bit more open? It's still focused on getting the client to do something to work towards maybe their goal of improving grades. But it's not telling them what to do, aka study. A couple other examples might be, do you think you should have asked your friend why they ignored you? So pause yourself here and think, what could you have asked instead? My answer might be, what is your communication style like with your friend? So it keeps it a little bit more open, gives you a lot more information than what just that little snippet of their conversation was, if they did have that. Instead, it tells them your client's perspective of how they communicated. Much more data there. Uh, then another one might be, did you consider drinking might be the problem? Oof, first of all, uh, that'll shut a client right down. So pause, think, how would you switch up that question? Again, that was, did you consider your drinking might be a problem? Okay, my answer or my switch up might be, how does your drinking impact your life, both for the better and worse? Now, you might say, wait, is that a multiple question? It could be, and I could definitely switch those up. But if I'm just going straight into that topic, I'm going to offer that this or that response because that's a skill called motivational interviewing, especially when you have a client with an addiction that's not ready to admit that it is an addiction yet. You want to roll with them. You don't want to immediately label the drinking as a problem because it does serve them in some way. So, kind of leaving that question open of how does it serve you or impact you both for the positive and for the negative and for the worse. It it immediate it doesn't put up that immediate feeling of judgment, so they're more apt to answer one way or the other. See, just with one question how deep you can get into the weeds with that. That's why knowing how to do it is so important. So why do we even ask questions, right? What do you need? You do it to either begin session or direct discussion. Say you want to start session off by talking about the homework from last week or jump straight into a specific topic. That'll be a time to use it. If you want to clarify an important part of the story when the facts are unclear, or if you want to encourage further discussion, so new ideas or self-exploration. This tends to be what we think we're doing when we ask kind of a less effective question. We think we're encouraging that discussion, but it can backfire. So again, we want to be really mindful, but this is where the meat happens. Questions are beautiful. They are a fantastic skill to use in therapy, and I want you to know that. I don't want you to think that you can't use questions because you can and you should, but it's being able to use them effectively that matters, and it can really take counseling to a whole new level. So there's two type of questions when we think about how they're used in therapy. We have open-ended questions and closed-ended questions, and they both serve very different and specific roles. So what we want to tend to use more often in therapy are open-ended questions. These that start with a stem of how, what, could, would, or why. And we'll talk about why in a little bit. But some examples might be, what was that experience like for you? Could you tell me more about that? And yes, you can argue, a client could say, no, I could not, or I will not. Typically, that kind of question will result in basically a tell me more about that kind of response, like a minimal encourage or a door opener. So we'll keep them as an open-ended question here. But I gave you that argument. If you have a client maybe who's very literal, like on the autism spectrum, if you say, could you tell me more about that? There is a good chance they could say no. And just know that is something about that client, and that is okay. So tailor your approach. Other examples, how did that experience affect you? In what way did that experience affect you? What is it you liked about the idea? And how could you change things? Just notice how each of those questions might influence a client's response. Now, what's nice about this is the client can choose the direction and the content of their response. You're giving them an open floor, a nice broader area to respond within. And what these questions do is they elicit deeper, more meaningful, and typically longer responses and gives the client control. Again, this is a space that we tend to want to stay in as a therapist. Now, some open-ended questions openers. I'm just going to leave this here for you to take a screenshot or to write down yourself, but these are some great ways to start asking questions, to have in your back pocket if you're feeling a little bit lost as far as what to say. I love some of these. Like I love I wonder. It doesn't always come off as a question, but it's just kind of putting out a hypothesis in such a soft way. Like, oh, I wonder what it would be like to explored that area in your career. Or I wonder what that must have been like for you, or I wonder what they must have been feeling. Okay. Lots of ways to do that. In what way? Tell me about. So you're seeing some door openers here as well. Great skill. If you got some of those written down, or I got a screenshot here, hopefully without my face in it, please. I'm sure it's not a great face with how the screen grabs work. All right, so why questions? I had those crossed out on that page, and that's because they are very tricky to use. We generally recommend you avoid why questions. I say generally, doesn't mean never, just like everything in counseling, there's no black or white, it's all gray, but they typically don't go off as well as we want them to. Now, often we don't know why to an answer. So you will typically get an I don't know response, or it'll lead to oh my goodness, intellectualizations or rationalizations. So you're going to spend session in philosophy, like philosophizing something that really doesn't support or help the client much, besides just thinking about thinking. So not quite helpful. It can lead to defensiveness. So I even just had a conversation with a client when a friend called them and they texted them back, "Why did you call me?" Turned into a huge fight of, well, why did you, like, what's your problem? Well, what are you talking about? What's my problem? I'm just asking you a question. Da, 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 da. Like, because they use the word why, it came off as an attack. So that could be a way that your client perceives it as well. So try to find another word to use it. Instead, try to paraphrase that question, or I like to switch it and use like a what. Usually, what question can answer that instead of a why did you do that? I'm like, oh, what were some of your choices in that moment, or what led you to make that choice? It was the same thing as why. It's a little wordier, but it's not gonna put up that immediate wall. So one of my other personal opinions as far as things to avoid, I would recommend limiting the use of the question, how did that make you feel? One, it's so trite. It's a counseling meme at this point. But in reality, it's much more effective to use your observation skills and empathic attending to infer the feeling and to really give yourself an opportunity to show empathy in that moment by reflecting the feeling instead. Now, again, not saying never ask, because sometimes you might not know. You might be very confused if a client talks about their family coming into town and they never talked about them before. You might ask, okay, so how does that make you feel? Because they could be excited about it or they could be dreading it. If you don't have context, you don't know. So again, never say never, but just something to keep in mind. Moving on to close-ended questions. These start with a do, have, did, are, or is, and they elicit specific information, usually one-word answers. These are really helpful for obtaining specific answers for assessment, especially risk assessment, and clarification. So one example is, have you had thoughts of killing yourself in the past 2 months? Very blunt. It's going to be a yes or no question, but that's going to give you some important information that you want to hone in on to ask more questions about. You don't want to use that as an open-ended question because you really need to know the answer to keep your client safe. Less serious, do you have siblings? That is just a nice way to gather information. So as I said before, you're more likely going to be using open-ended questions as a counselor, but closed-ended questions are still things that you need to use, and they're very important and very useful, but you need to be mindful of when you're using them because they do different things to a session. And as you kind of heard earlier, those closed-ended questions can come off as leading or as advice. Now, some considerations, it's really important that you meet the client where they're at. Open-ended questions may work best with verbal clients or an established therapeutic relationship. It encourages the client to continue talking without asking for specific information. So avoid a yes/no response from a closed question. And it encourages client autonomy. However, less talkative clients may need a warm-up or informal conversation before engaging. Usually the first session, if depending on the client, I might start with some light small talk of the traffic getting here or how they're doing right now or something really random, just to kind of help warm them up and to get a baseline. So this is a nice little tip and tool for using questions. It's facilitating movement up the ladder of abstraction. So if you have a client who's not answering questions really directly, you have no clue really what is going on, what they were saying, what happened in a situation. These kind of questions can help obtain a concrete uh, picture and provide specific feelings, thoughts, and examples of action. So you use the ABC pattern. So it's antecedent, behavior, and consequence. So what happened first? And then what? And then what? And what did you do when that happened? Right? When you get to one, that's important. And what happened afterward? Right? So that gives you a lot more information, kind of helps keep them on track if they need it. You can ask them about their thoughts. So what was going on in your mind at that specific moment? And what were your emotions after? So this will help tailor that and give you more information. All right. So this is the big question I typically get in class. What do you do if a client asks you a question? Right? That can be really intimidating because how do you respond? Right? And I'm not saying you never respond, but before you do, you want to think about why it is that the client is asking you that question. What kind of needs are they trying to get met from asking you? And then how might your response impact them or provide them with that need? Because direct answers would be a form of self-disclosure related to our view, experience, or perspectives of an issue. They're not always what the client needs or wants in a moment. So you want to consider what the underlying need might be. So here are some examples. One might be when the client says, I hate my mom's boyfriend, what should I do? So they're not necessarily asking you for advice of what they should or should not do. What they're needing in that moment is guidance. They feel like they need a plan. They might want to explore different options. And so instead of answering that, you will reflect that back with a paraphrase or a reflection of feeling or meaning. You might say something like, it sounds like you really don't like him and you feel stuck as far as what to do when he comes over. Right? That throws it back to them and they'll explore a little bit more. Another one is, why did my parents get divorced? Is it because of me? Oof, right? That's a hard one. My immediate pull would be, no, of course not. Right? They want like I'm feeling that pull to give them support. And that's what they need. They want some sort of validation, maybe support, affirmation, confirmation that it wasn't their fault. Right? And so before you provide that for them, you want to consider what will that do? Will that be the most effective thing in that moment? Or first, you want to explore that need, help them see that there. Because if they're pulling that from you, maybe they're pulling that from someone else. So you might reflect. You're really not sure why they got divorced, and it's really hard not to consider your role in it. And if that were kind of what, oh, I'll stop there. You don't need to keep going. See, I have that tendency too. I want to keep going and provide more and more thoughts, questions. It's okay to just leave it with a couple statements. So you feel really confused about why your parents got divorced and wondering what your role is in all of that. You might even add in a reflection of feeling, gosh, you're feeling really guilty or confused. And so that'll help dig deeper into what the client is experiencing before looking into that validation. I'll leave these 3 more examples here for you to explore what you might think those are. So take a moment to pause and look at them and try to guess what the client need might be and how would you respond? Oh, the other consideration, I don't have a point for that here, but what do you do if a client asks you a question about yourself? Same situation. You want to think about what the underlying need might be. I remember earlier on, I would get questions from clients who are parents, and they would ask me, "Oh, well, do you have kids?" And I would respond with, "It sounds like it's really important for you to have someone who understands what it's like to be a parent and to just understand those specific struggles and joys." Now, I don't have kids, but I promise I'm going to do everything I can to understand your perspective. And if I'm ever getting it wrong, please let me know. But I'm going to do my best. Right. So that was some self disclosure there because I'm not going to lie. I'm not going to necessarily withhold that information because they're going to know I'm withholding it. They will call it out later, like, "Oh, well, I don't know anything about you." Uh, But so I'm going to answer because that particularly feels safe. But what I'm really going to do is I'm going to meet their need and provide that validation and recognition that they want to be understood, and that I'm going to seek to try to do that. So, little tricky. You'll get better with it at times. It's okay to make mistakes, but reflect on it and see ways to be able to improve as you move forward. So all of this goes back to those layers of the presenting issue. Notice how your questions influence the depth of sharing and how they affect your client. So if you have any questions about questions, go ahead and email me, Dr. Allen at lkallen@scu.edu. I look forward to hearing from you. Take care, everybody.